If you are worried you have Lyme disease, or just like the outdoors, and want the peace of mind of knowing whether you have Lyme disease or not, there is a new Lyme screening test based on decades of research by Dr. Richard Marconi, a professor at VCU Medical Center. For more information, visit glymedx.com, that's glymedx.com, or email at info@glymedx.com.
Infectious diseases, research, medicine, health. Welcome to Outbreak News Interviews. And now, broadcasting from the Outbreak News Skylar Studios in beautiful West Central Florida, here is your host, microbiologist and editor of OutbreakNewsToday.com, Robert Harriman.
Hey everybody, this is Robert, and welcome to the show. No interview today, but an interesting topic nonetheless. Monkeypox. Now, monkeypox is a rare viral disease that occurs mainly in the rainforest countries of Central and West Africa. It resembles smallpox, but unlike smallpox, it is acquired from animals. The disease was first discovered in laboratory monkeys in 1958. Blood tests of animals in Africa later found evidence of monkeypox infection in a number of African rodents. The virus that causes monkeypox was recovered from an African squirrel, which may be the natural host. Laboratory studies show that the virus could also infect mice, rats, and rabbits. Now, human monkeypox was first reported in the Democratic Republic of the Congo, formerly known as Zaire, in 1970, ironically in a region where smallpox had been eradicated just 2 years earlier. Monkeypox is currently endemic only in Central and West Africa. Now, at the website OutbreakNewsToday.com, we've been keeping a close eye on the current Nigeria outbreak since the first case was reported in late September. Now, the number of confirmed monkeypox cases in Nigeria has risen to 38 in 8 states and the Federal Capital Territory as of November 2nd, according to the Nigeria Center for Disease Control. The U.S. Centers for Disease Control and Prevention has deployed a team of biologists and epidemiologists to Africa to track and investigate monkeypox. Now, according to the Washington Post, the international experts will be working with a local team to track the spread of disease during an outbreak with the aim of stopping it. Now, did you know, or do you remember, that there was a monkeypox outbreak right here in the United States during the summer of 2003? The CDC was receiving reports of patients with a febrile rash illness who had close contact with pet prairie dogs and other animals. The Marshfield Clinic in Marshfield, Wisconsin, identified a virus morphologically consistent with a pox virus by electron microscopy of skin lesion tissue from a patient, lymph node tissue from the patient's pet prairie dog, and isolates of virus from culture of these tissues. Additional laboratory testing at the CDC indicated that the causative agent was the monkeypox virus. In the end, 47 confirmed and probable cases of monkeypox were reported from 5 states: Illinois, Indiana, Kansas, Missouri, and Wisconsin. Now, according to the investigation, the virus was introduced into the country via a shipment of animals from Ghana. They were imported to Texas on April 9th, 2003. Now, the shipment contained approximately 800 small mammals representing 9 different species, including at least 6 genera of African rodents. These rodents included rope squirrels, tree squirrels, African giant pouched rats, brush-tailed porcupines, dormice, and striped mice. CDC testing using PCR and virus isolation demonstrated that 2 African giant pouched rats, 9 dormice, and 3 rope squirrels were infected with monkeypox virus. After importation into the United States, some of the infected animals were housed in close proximity to prairie dogs at the facilities of an Illinois animal vendor. These prairie dogs were sold as pets prior to them developing signs of infection. Now, all people infected with monkeypox became ill after having contact with the infected prairie dogs purchased as pets. A study conducted after the outbreak suggested that certain activities associated with the animals were more likely to lead to monkeypox. Now, these included touching a sick animal or receiving a bite or scratch that broke the skin. Another important factor was cleaning the cage or touching the bedding of a sick animal. No instances of monkeypox were attributed exclusively to person-to-person contact. Now, during the U.S. outbreak, illness in animals included symptoms of fever, cough, discharge from the eyes, and large lymph nodes, accompanied by development of lesions. Animals that had monkeypox also appeared to be very tired and were not eating or drinking. Some animals had only minimal signs of illness and recovered, while others died. Now, a number of actions were taken to contain the outbreak, to include an issuance of an immediate embargo and prohibition on the importation, interstate transportation, sale, and release into the environment of certain rodents and prairie dogs. And interim guidance was issued on the use of smallpox vaccine, cidofovir, and vaccinia immune globulin in a setting of an outbreak of monkeypox, among many others. Let's talk a little bit about the disease in humans itself. Now, most outbreaks in the past have been short-lived and self-limiting, with only limited person-to-person spread. Through the mid-1980s, estimates of the human-to-human transmission rates range from about 3% to 30%. However, during a relatively recent outbreak in the Democratic Republic of Congo, which continued for more than a year, the person-to-person transmission rate was estimated at 73%. Some researchers speculate that people may have become more susceptible to monkeypox with the ending of vaccination for smallpox. Now, the increased person-to-person transmission rate remains to be confirmed, as the outbreak occurred during a period of civil war, and the study was cut short. Now, estimates of case fatality rate for monkeypox in Africa vary from about 1% to 15%, with the highest risk of death in young children. In one study of 300 patients in the Democratic Republic of Congo, the overall mortality rate was 10%. Now, no deaths were reported in the U.S. outbreak. Now, in 2005, researchers from St. Louis University and their colleagues concluded that some strains of monkeypox are more virulent than others, depending on where in Africa the virus came from. There are at least 2 different genetic types or clades of the virus. Now, the strain introduced into the U.S. came from Ghana, located in West Africa. Human infections with Central African monkeypox virus are typically more severe than infections with the West African virus type. There have been no human deaths recorded attributable to infection with West African type monkeypox virus. Now, this may explain why no deaths have been reported in the Nigeria outbreak to date. In humans, monkeypox is similar to smallpox, although it is often quite a bit milder. Unlike smallpox, monkeypox causes lymph nodes to swell. The incubation period for monkeypox is about 12 days. The illness begins with fever, headache, muscle aches, backache, swollen lymph nodes, a general feeling of discomfort, and exhaustion. Within a day to 3 days, sometimes even longer, after the appearance of fever, the patient develops a papular rash, essentially looking like raised bumps. Often first on the face, but sometimes initially on other parts of the body. The lesions usually develop through several stages before crusting and falling off. The illness typically lasts for about 2 to 4 weeks. Now, the treatment of monkeypox is mainly supportive. The antiretroviral drug cidofovir has been promising in vitro and in animal studies, but its efficacy against monkeypox in humans is unknown. Smallpox vaccination, particularly when recent, appears to provide some protection from monkeypox and has been recommended for some groups at high risk of exposure. Post-exposure vaccination also seems to be helpful.